So if you suffer from gas and bloating and you don't know why, here are 5 reasons why this could happen. So the first is a food intolerance to things like dairy, which contain lactose, certain carbohydrates, and things like gluten. So the way to treat this is actually through dietary modifications. A lot of it's trial and error, and you kind of need to do it in a stepwise fashion. So try cutting out some dairy, then following something called a low FODMAP diet, which can help you eliminate certain carbohydrates you may be intolerant to. And then also last, if you may want to try cutting out gluten products. A second reason for gas and bloating is actually constipation. If you have incomplete bowel movements, if you're not having a bowel movement every day or every other day, this can actually contribute to gas buildup. Do things to try to have more complete bowel movements, things like increasing dietary fiber and increasing fruits and vegetables in your diet that promote bowel movements. Number 3, slowed gut motility. When it's really slow, sometimes you get gas buildup. And this can happen in diabetics, which causes something called gastroparesis, it means a slow stomach, and in people with thyroid disorders. Before would be a disorder called small intestinal bacterial overgrowth, also called SIBO. This actually means that there's an overgrowth of bacteria in the small intestine that actually should not normally be there, and this can alter digestion, this can cause gas buildup, and this is actually tested for with a breath test. And number 5, what we call a functional disorder. And what this really means is atypical functioning of the gut. It's usually due to a multitude of different factors, and that's usually coupled with a disorder of the gut-brain interaction, which can alter digestion and the feeling of gas, bloating, and pain. Usually functional disorders require multiple different types of treatments, including dietary changes, probiotics, and medications, which can increase serotonin levels in the gut.